Bloodletting and Leeches. In this episode of The Casual Nerd, following the book Emperor of All Maladies, we will learn about the rise and fall of humor theory and how we progress out of the dark ages of surgery. The Greeks were captivated by fluid mechanics and tried to apply this to medicine. Hippocrates proposed the four humors theory of blood, yellow bile, phlegm, and black bile being in a precarious balance within the body. The theory stated that when someone was sick, the balance of one of these was off and needed to be rebalanced, usually by bloodletting and purging. A Greek doctor around 160 AD named Claudius Galen tried to classify the illnesses which different humors belonged to. Cancer, and interestingly depression, were both thought to be associated with black bile. In his theory, Galen thought that tumors were an accumulation of black bile that was trapped, and that you could cut it out, but that it would refill, and therefore surgery on it was pointless. Long after Galen's death, the theory of black bile being linked to cancer would, like Bennett's theory of separation of blood, lead doctors on a red herring. It was probably in a way a good thing that Galen's theory of surgery not being effective deterred many from seeking it, as surgery was barbaric, unsafe, and unmedicated, and would often cause more harm than it solved. In 1533, a young Andreas Vesalius came to the University of Paris to learn surgery and Galen's theory of pathology. What he found was more of an unorganized butchering of cadavers and a cramped basement with even dogs chewing on the bones. Vesalius was appalled that there seemed to be no rhyme or reason to these dissections as surgeons hacked through the bodies. Frustrated at the lack of knowledge behind what they were doing, he decided to create an anatomical map, translated in English to On the Fabric of the Human Body in 7 books. For his research, he would search graveyards for fresh bodies and eventually find that executed criminals left in the streets was a good source for his studies. In 1538, along with the help of artists, Vesalius began to publish his maps on the human anatomy that were as meticulous as even covering the arteries, veins, nerves, and lymph nodes. Part of the reason for mapping out things such as the veins was that in Galen's humors theory, bloodletting would have to be performed at a specific spot, at the veins leading into the tumor, though without an anatomical map, doctors didn't know what was considered leading into a tumor versus what was leading out of a tumor, based on Galen's instructions. It was pretty vague. However, through all of his dissections, Vesalius never came across the black bile which he had heard so much about. Vesalius was troubled by this, as he was a big fan of Galen's theory and didn't want to speak against it. After all, this would mean a huge disruption in the medical theory that had been working for roughly 2,000 years. So Vesalius just showed what he saw and would let others come to the same conclusion. In 1793, a man named Matthew Baillie from London took Vesalius up on that silent offer. Baillie would also make a book called The Morbid Anatomy. As Vesalius mapped out the anatomy of a normal, relatively healthy body, Baillie mapped out the bodies of the diseased and abnormal. If black bile existed, it would surely be in one of these. However, like Vesalius, Baillie never found any. With this, it was becoming obvious that black bile just didn't exist. And with that discovery, the idea of tumors being operable was back on the table. Baillie's uncle, John Hunter, began performing surgeries of tumors in 1760. He was obsessed and continually worked on cadavers with little sleep. He started classifying tumors into stages: movable, which were early stage tumors, and immovable, which were more advanced metastatic cancers. While Hunter could work endlessly on the cadavers, his ability to work on live patients was limited due to primitive surgery practices. Hunter determined that only movable cancers were really worth removing, as surgery was still painful and very risky at the time. That was until 2 discoveries changed everything. In 1946, a dentist named William Morton used vaporized ether on a patient in a crowded demonstration to show its anesthetic effects. His patient, Edward Abbott, said that he was aware of the operation but didn't feel any pain. This new anesthetic opened up the possibilities of longer surgeries. Surgeries also had a troubling rate of post-op infection, which, in a time before germ theory, often led to death. In 1865, Scottish surgeon Joseph Lister observed that wounds left open to the air would turn gangrenous, while closed wounds wouldn't. He realized that this was similar to French chemist Louis Pasteur's discovery that meat broth left open to air would spoil, while when it was in a sterile vacuum jar, it would not. Louis Pasteur's theory was that invisible bacteria had fallen out of the air into the broth, causing it to spoil. Lister then applied this idea to surgeries, the idea that bacteria may be falling into the patients during surgery, causing their infections. Lister thought he could apply some sort of chemical to kill the invisible organisms, aka bacteria. Lister had noticed that people people who disposed sewage in a nearby neighborhood used a liquid containing carbolic acid to treat the waste. Lister began applying a carbolic acid paste to post-op wounds. Lister's theory was put to the test in 1867 when a 13-year-old boy came to him with a severe cut from a machinery accident. The wound was covered in dirt, and Lister knew it was likely to become gangrenous. The best solution at that time would be amputation. Instead, Lister decided to take a chance on his carbolic acid paste. For weeks, the wound seemed as if it would turn sour at any minute, but Lister was committed and intense with his application. Eventually, the wound healed, and miraculously, the kid was able to keep his arm. Soon after, Lister became so confident in his antiseptic that in 1869, he removed a breast tumor from his sister using both anesthesia, ether, and his antiseptic, carbolic acid paste, with no post-op infection. Lister's antiseptic became a huge step forward in the world of medicine and surgery. With both anesthesia and antiseptic now in use, surgery became a viable option. Thanks for watching. If you enjoyed this dive into medical history, be sure to subscribe and follow along with our ongoing series on the history of cancer, where we trace the breakthroughs, setbacks, and stories that shaped what we know today.